Hello and welcome to The Hub. I'm Wang Guan in Beijing. 2 years on, the world is still grappling with COVID-19 with a new global resurgence. The Republic of Korea has reported over 7.5 million new cases in the last 29 days, and deaths crossed 5,000. In another hemisphere, the United States has 1.2 million new cases with over 34,000 deaths. Here in China, a country that has had a strong record, will have the first 2 pandemic-related deaths on the Chinese mainland in a year. While in the Hong Kong Special Administrative Region, the region says its fifth wave has peaked and relaxed restrictions. What triggered this global upsurge? What is the future? Live with COVID or eradicate the virus? Now let's look into the pros and cons with Dr. Hyun-Kyung Tan, internal medicine specialist with the MizMedi Women's Hospital from Seoul, South Korea, and also Dr. Gary Richwald, Chief Medical Officer of Real Health, who's joining us from Los Angeles, the United States. Welcome to the Hub. Let me go to you first, if I may, Dr. Tan. We've seen new infections surging all over the world in the new year, especially in the month of February. Of course, the causes for this uptick can be different across the region, but do you see any common thread, any commonalities in this round of surge?
It's all due to Omicron. This Omicron variant is so transmissible, and also it has the immune evasion properties that have really eroded some of the vaccine effectiveness in terms of infection. Of course, vaccine effectiveness to protect against severe disease and death remain high. However, because it is so transmissible and it evades immunity, that's why it's able to spread across strong in the populations, especially if we are dealing with regions that have high population density, such as Hong Kong or South Korea. I think that's why we're seeing such a huge explosion of new daily cases.
Dr. Richwald, what do you think are behind this round of surge? And also, if you compare different regions and countries and their practices of prevention and control, are there lessons that we can draw from this round of uptick?
Well, I think the number one lesson is complacency. We've actually seen this before. This is not a new show. We saw this in spring and summer 2020, spring and summer 2021, and here we are in 2022. And in addition to what Dr. Tan said, I think we have waning immunity because it's been months to years since some people have either been infected or, on the other hand, have had their vaccination. So the issue of the protectiveness of either natural infection or vaccination, is an issue. And I think we also are relaxing our public health prevention measures across the board. I think across the world, people are just sick and tired of being in a pandemic and all the restrictions, heartache, and financial issues that it causes. And rather than doubling down, which is what most public health experts recommend, so at the time when we can get the rate of reproduction of the virus down to its lowest value, which is spring and summer, before we all go back indoors in the fall, and that at that time you want to drive the infection rate so low that so few variants are going to emerge with so few mutations that you're not going to have another nasty Omicron problem. And if you can do that, then there tends to be a waning of the pandemic to the point where, as I know everyone's heard, it becomes endemic or just a background problem.
Right. So, Dr. Richwald, you mentioned a waning effectiveness or a waning immunity. Many of our average viewers might not be extremely familiar with this term. They're not doctors after all. Can you explain to them, does that mean the longer away you are from your last vaccine shot, the less efficacy there can be from the shots?
Right, exactly. Not just from the shots, but of course, in many of the countries, people, certainly in the United States, we've had, well over 80 million infections. And so that's an enormous number. And as time goes on, the immune system has a natural loss of capacity, because we're designed to be to deal with, if you think about us 1,000 or 10,000 years ago, we're designed to deal with multiple infections. So as one infection goes away, man 1,000 years ago had to get ready for another infection. The immune system only has so much capacity, and as a result, the immune system was designed to step up, do what it needs to, and then in some sense become less powerful. That's why we get booster shots, and that's why some people get infected again. Those breakthrough infections provide good, strong immunity. So unfortunately, time goes on, and we have less immunity. And then you get hit by something like Omicron, a mutant of the virus that is, as Dr. Tan said, more contagious. And you're stuck with extremely large rates. The whole control of COVID is based on lining up the vaccines and other control measures with how much hospital capacity you have. China did a terrific job, as South Korea did, in containing the virus in the first 2 years of the pandemic. However, it left them with a lot of vulnerable people who's either have never been infected, or as elderly people, as we know in Hong Kong, a lot of the elderly have not been vaccinated. And what happens in that kind of scenario is a very reproductive virus like Omicron just can wash through the population and affect an enormous number of people.
Yeah, Dr. Richwald, we'll talk about Hong Kong region as well, the Chinese mainland and South Korea soon. But Dr. Tan, I want to turn to you because a senior World Health Organization official, Dr. Bruce Aylward, has a warning. With more transmissions, he said the virus gets more opportunity to replicate and mutate, which means we have more risks of new variants. Do you foresee that vicious cycle becoming a reality?
I completely expect that we will see more variants. My concern is not only recombinant variants among human coronavirus strains, but we also have the risk of recombinant variants between human and animal strains. Right now in North America, the SARS-CoV-2 virus has infected large populations of white-tailed deer. We know that this was also a problem among farmed mink. And so we have the possibility now of recombination between animal and human SARS-CoV-2 strains, in which case you could have the result of a much more virulent strain that also is more transmissible. A super Omicron can emerge. And so this is something that we need to prepare for. And as long as there are transmissions, yes, there is the possibility of new variants forming. And as I mentioned, the human to animal interface is something that we need to monitor very carefully as well.
So Dr. Tan, what could that super Omicron look like? Will the new varieties be less lethal, as is the case with the current Omicron?
Not necessarily. Perhaps, we lucked out with the Omicron, but we could have a virus that is more virulent, leading to more severe disease. So this is the mutations, they occur on a random basis. So it's not necessarily true that we will slide into endemicity. We could be hit by a more virulent, more transmissible strain in the future. And this is something that we need to consider and be prepared for. The best case scenario would be if we had a less virulent virus, but that's not necessarily the case.
All right. Certainly. Dr. Richwald, the new variants are highly infectious, but the symptoms are apparently milder. As the virus seemingly grows less lethal, more people think that herd immunity will be a solution, and from a pandemic, COVID-19 will become endemic, as Dr. Tan suggested. What is your opinion?
Well, it would be a blessing if we had a variant that provided immunity, stimulated our immune system, and caused very little symptoms, if any. But, that hasn't been the case with Alpha, Delta, or Omicron. I mean, it's wishful that we have that. But, what I'm looking at is a seesaw battle between new variants and a governmental and public situation where we just become complacent. We do well for a while, and then we are just slammed with one of these variants. But in the United States, we have a situation where I think we've nearly given up on vaccinating the last 20-30% of people. We're actually reducing the number of testing centers. We're not having testing requirements for transportation and for other kinds for school, transportation, travel, gyms, and other things. We're certainly jettisoning our masks, and we're reducing quarantine and isolation. These are core pillars of public health control, whether you're in Hong Kong, China, Los Angeles, New York, Canada, wherever. And it's a bad combination to be releasing these pillars of protection at a time when we should be, as I said before, not complacent and doubling down. But politically, I think this has become a political problem, because if you look at Western Europe, where they've been having some terrible problems, in the UK, France, and Germany, what happens is you have people on the one hand, this is sort of the talking out of both sides of your mouth problem. On the one hand, they're concerned about the outbreak, and on the other hand, they're basically relaxing all of the public health measures. This is a political issue, and tell people what they want to hear, not what they need to do, and that's challenging.
Yeah, I mean, time and again we saw politics, is being driven by populism. Dr. Tan, let me turn to you. Help us understand something that everyone's talking about these days. That is, though the Republic of Korea has one of the highest numbers of infections, it also has one of the lowest number of deaths. How has that been possible?
Right. So for the first 2 years of the pandemic, we had a policy of testing, treating, tracing, isolation, and really trying to engender the public trust through good communication. And once we had the public's trust, we could implement the public health and social distancing measures that kept our fatality rate very, very low. With Omicron, we've had to shift some of our strategies. In terms of isolation, previously all of our cases were sent to monitored isolation facilities. But now that Omicron is so widespread, and also there's so many people who have only mild disease or asymptomatic disease, we've switched to home quarantine. Once vaccines became available, we started our national vaccination campaign January 2021, and it has been very orderly and very successful. We've had high uptake of the vaccines in our country. In terms of 2 doses, if we look at the entire population, we have a vaccination rate of 87%. When we look at the high-risk population of people age 60 and over, the uptake of 2 doses is 96%. Once we noticed that vaccine effectiveness was waning, we embarked on a very aggressive booster vaccination campaign. And in the high-risk population, seniors age 60 and above, the uptake of boosters is 89%. And I really think that it was our vaccination campaign that was able to keep fatalities low. Now, with Omicron, it has changed. It is so transmissible, and it has infiltrated into our long-term care facilities, nursing homes, and convalescent hospitals. And of course, that's where the most elderly and frail members of our society are. And unfortunately, it has caused massive outbreaks in these long-term care facilities, infecting anywhere from 100 to up to 300 of the residents in these facilities. And unfortunately, it's caused a high number of deaths. So in the month of March, we've had 5,400 deaths alone, which overshadows any other of the waves that we had previous to Omicron. And so I think this just goes to speak to how much we need to perhaps target our protection to the most vulnerable. Yesterday I was speaking with someone from China, and I think the closed loop strategy that was used for the Olympics, perhaps that's something that could be applied to high-risk facilities such as nursing homes and convalescent hospitals, because vaccinations will only take you so far.
Yeah, let's talk about China. Dr. Richwald, in China, more than 95% of the new infections are mild or asymptomatic. So some are urging China to give up its dynamic zero COVID policy. Many international news outlets singled out the fact that China had, a recent resurgence of COVID and COVID-related deaths, which numbered 2, so far this year. What do you think of China's quote-unquote dynamic zero COVID policy?
Well, policies are based on the time. And I think China's policy was a strong policy for the first year or two of the pandemic. But ultimately, it left a large vulnerable population. And I'm not sure I agree 100% with Dr. Tan. I'd say no man is an island, no nursing home is an island. And we're not going to just be able to protect nursing homes if we don't protect the staff who work in them, the frontline workers, the grocery store workers, the people who prepare the food in nursing homes. I think that there's a critical need to understand it's not just all the countries of the world, but within our own countries, individually speaking, we need to make sure that the general population has as tight a control as possible. Now, the Chinese approach of locking down large numbers of cities, cutting off manufacturing, etc., I think was important in its time. But I think that there needs to be a psychological understanding that we need to still be vigilant and figure out the things that can be done. Look, masking is not that hard. It's not that hard to invoke testing. It's not that difficult for people to self-isolate. Not everybody's going to do it right, but the large majority will.
Alrighty, Dr. Richwald, that's all the time we have. We have to leave it there. Thank you so much for you and Dr. Tan for sharing with us your insights, for shedding light on this very important issue. Thank you very much.